Yeah.
And I actually used to have to do 2 different appointments, I think, for the ultrasound and mammogram.
Probably, yeah.
Yeah.
Yep. And 2 different locations. Now the OBGYNs are starting to get smart and have it like at their actual OBGYN clinic. I don't necessarily have to go to a different location, but I remember like the worst appointment was going in and then getting the mammogram and then going back to the waiting room and then waiting like another hour to get the ultrasound and then leaving and then getting the bill. It's like,
yeah.
Anna, do you want to talk about the amount of cancers detected through mammography?
Yes. So there was a study in cancer detection and prevention in 2007 that kind of walked through the history of mammography. And when we think about, as Brigitte said, in the early days in the 70s, normally you only went in if you felt something. And so about 4% of breast cancers.
Oncology world is, I guess I just thought because it's cancer and it's so specialized and like death is a big thing that can happen if we do not take care of it. I had also thought that the entire healthcare system had organized itself properly to take care of patients and be proactive. And then once someone is diagnosed, have a perfect system in place to save these lives. And I mean, as we're starting to talk about here and what I'm seeing with my clients, it's wow, no. I don't want to know the results community. So I could imagine one, just not wanting to know results generally and not wanting to be proactive, but they're probably the ones not getting even the mammograms. For the I don't have time, I could definitely see, this being like, holy cow, thank you so much. You've saved my life. You've saved
each other in ways that move the needle for each of us. And I think that it's part of this much bigger movement towards science no longer just relying on randomized controlled trials, this model where everything stops moving and only one variable is allowed to move. That's not a model that is very representative of anybody's life. And so as we move more and more using these technologies into understanding that ebb and flow of our health behaviors and their specific